Good morning and welcome to the little apartment on the prairie. Let me start by putting your mind at ease if you're worried that you're going to see some gory footage of a tooth being pulled. You're not. I'm just going to tell you about it, but you're not going to see it. Alright, so if you've watched my last couple of videos, you may have noticed there is a gap in my teeth that wasn't there a short time ago. You probably noticed before that I'm missing a few teeth on top. There's a whole story about that, but I'm not going to tell that story right now. I'm going to tell you about my bottom tooth. So I really kicked around this idea of doing a video about this and whether or not I wanted to. And the main reason I decided to is because, I have the opportunity with this YouTube channel to bring awareness to lots of things that people may not be aware of. And so I want to take that opportunity to do that. So a couple weeks ago, I started having a lot of pain, not just in my mouth, but really the whole lower half of my face. My chin felt like it was bruised. My bottom lip felt like, like it was burnt or something. It was really sore. The glands under my chin were really swollen and tender. So I had this tooth that was a little bit loose and the gum line was receding. Hi, whiskers. And I figured that tooth was causing the problem. And I figured I was going to need to go to the dentist. So now I have Medicare because I'm on disability and it's good insurance, but it doesn't cover dental. It also doesn't cover vision or hearing aids. Apparently our government has decided that teeth and, the ability to see or hear, those are luxuries. They're not necessary. So I'm pretty sure Medicare covers Viagra though. So apparently the ability to get it up is a necessity, but teeth are a luxury. Anyway, so I also knew I didn't have enough money to pay for a dentist, but there are a couple places in Lincoln, which is about an hour from where I live, that do dental care on a sliding fee scale. So the fee is based on your income. So I called them and was told that they weren't taking new patients because of the pandemic. And I asked if they had any, suggestions for me for what I should do, and they did not. Now, I'm good at finding resources. I used to be a social worker before I became disabled. I'm good at finding services and resources. There was nothing available because of the pandemic. So I decided to make an appointment with my regular healthcare provider, and she's actually a physician's assistant, but she's good. And because I was pretty sure I needed antibiotics, so I figured she could give me antibiotics, and maybe she could advise me, was this tooth going to need pulled, which is what I thought. And maybe she'd even have some suggestion about how I could get dental care. So I went to her, and she took one look at my mouth and said, "Oh, you have a huge abscess." I was like, "Yeah." So she gave me antibiotics. She also gave me some pain pills, which I guess that abscess looked really painful because it seems like it's hard to get pain medication out of doctors nowadays. But I can't take NSAIDs, so I can't take ibuprofen or Advil, stuff like that. And Tylenol just was not doing it. And anyway, so I got a few pain pills out of her. And she said, yeah, that tooth is going to need pulled. She said probably you should be on antibiotics for about a week before they pull it. But yeah, you need to get to a dentist. And I told her how I couldn't find a dentist and didn't have money for a dentist. She suggested I call a local dentist. She said she wasn't sure, but they might have reasonable fees or they might be willing to let me make payments. So I called that dentist and they did not have reasonable fees and they were not willing to let me make payments. They wanted $80 just to look at my mouth, just to look. And they told me that extraction started at $160, but it could cost more based on various factors. Well, I did not have $240. A friend of mine offered to loan me the money, and I considered that, but it was going to be really difficult for me to pay it back. And this same friend had also actually paid for Isaac's medication recently, because with his vet bills and his blood work and other stuff, I was having trouble coming up with the money, and this friend offered to pay for his medication, and I happen to know that this person doesn't. It's not like they're rolling in dough. And I didn't want to ask more from them, but also I knew it was going to be really difficult for me to pay back the money. Isaac's, with his arthritis, it's extra money. What are you doing, Sassy? Sassy, don't claw the carpet. Good grief, that cat. And so, if it comes down to a choice between me going to the dentist or Isaac getting his medication for his arthritis, Isaac is getting his medication, hands down. I'd rather be in pain than Isaac be in pain. Anyway, so I ended up deciding I didn't want to borrow the money. I decided that I was going to pull the tooth myself, or actually a friend offered to pull the tooth for me. And I considered making a video of it, but my friend was not real comfortable with that. It's actually illegal to practice dentistry without a license. It's probably legal to pull your own tooth, but it's illegal to pull somebody else's. Not illegal for a dentist to not treat you because you don't have money. Not illegal to be in, pain because you have a big abscess in your gum. But illegal for somebody to pull the tooth for you. Just like it's illegal to practice medicine without a license. But I didn't think I could pull it myself. I could have somebody else pull it, but I didn't think I was going to be able to do it myself. So I decided that's what I was going to do. It needed to come out. That was the only way it was going to come out. I only told, I think, 2 people before I did it, because I didn't want people to feel sorry for me, and I didn't want it to seem like I was like hinting for people to give me money, and I also didn't want people to tell me that, I shouldn't do it or that it was stupid, because I felt like that the tooth really needed to come out, and that was the only way it was going to come out. So I had been on the antibiotics for almost a week, and Isaac. So I'm going to tell you about how it went down, and I am not telling you that you should pull your own tooth or get somebody else to pull it for you. In fact, if there's any way that you can access dental care, if you need a tooth pulled, I think you should do it. But here's what I found when I was considering pulling it myself or having a friend pull it. I started looking up stuff online, trying to look up how to pull your own tooth. Well, if you Google on YouTube how to pull your own tooth, you'll find videos of people pulling their own teeth if you want to see that. But what was interesting was not just that there were several videos of people doing that, but if you read the comments, there were a whole bunch of people saying how they'd done the same thing. Bring me your Kong, Isaac. Bring it here. I give you a treat. Bring it. And then there were a bunch of comments with people saying, wow, I found this video because I'm thinking I'm going to have to pull my own tooth, and I'm surprised to see how many people have been in this position. And that is amazing. I was aware that some people pull their own teeth. I've actually got 2 friends who have pulled their own teeth before, but I wasn't aware of how common it was in the United States. And every once in a while in the comments on these YouTube videos, there'd be a comment from someone from another country going, what the heck? You mean you can't, dental care isn't covered by insurance, or they won't take care of your teeth if you don't have money? Because people in other countries are always surprised at how our healthcare system works. But this is like a really common thing, and that's what I want people to be aware of. So what I did was I took one of the pain pills that were prescribed by my doctor or my physician's assistant, and I took one of my pills for anxiety, which are prescribed by my psychiatrist, and according to my pharmacist, they're safe to take together. And I took a shot of vodka. Now, you're not supposed to really drink with this medication, but it was a shot. So, we like sterilized some pliers, and my friend had gloves on and yanked on the tooth, and it did not come out the first time, which I had not considered that possibility. I was like, well, crap. So I decided I better take another shot of vodka. I almost never drink. I don't think I've ever had a shot of vodka before, except this. So, anyway, I wasn't going to drink enough that I didn't want to get nauseous or have a hangover or anything like that. I just wanted to be a little bit relaxed and not in a whole lot of pain. So my friend had to yank a couple times before the tooth came out, but it wasn't too difficult to get it out. It hurt, but it was nowhere near the most painful thing I've experienced before. Bled a little bit. I took a rolled up piece of gauze and stuck it in the gap and bit down on it for a few minutes, and it quit bleeding. By the next day, my swollen glands were all gone, and everything felt better. The gum was just slightly tender where the tooth had been pulled, but everything else felt better. That tooth absolutely needed to come out, and it was not going to get better if it didn't come out. So I don't regret doing it. What I do think is a problem, though, is that we live in a society where people need to resort to doing this kind of thing. So I guess that's one of the main reasons I wanted to do a video about this. I wanted people to understand that this is an issue. And if this concerns you, there are some things you can do about it. You can contact your elected representatives and tell them that you think Medicare needs to cover dental care. You can tell them you think there should be some sort of universal health coverage that should include dental care. If Medicaid in your state does not cover dental, in some states it does, and some it doesn't, and some it's only for children but not for adults, you can contact your elected representatives and tell them you want Medicaid to cover dental care. And if you've got any extra cash to donate, if there is a free or low-cost dental clinic in your community, you can donate money to them. So that's, if you're wondering what you can do about this problem, that's what it is. So let me know in the comments if you've ever pulled your own tooth, or if you know people who've done it, or kind of what you do if you can't go to the dentist. I feel like sharing these stories is a good first step towards changing the way things are. And again, I'm not telling you should pull your tooth. I feel much better now that it's out. I'm fine. It went fine. Like, don't feel sorry for me because I pulled my own tooth. That's not what I want. Don't forget to give this video a thumbs up. Subscribe if you haven't yet. If you hit the little bell icon, YouTube is supposed to notify you when I post new videos. Whiskers, don't smack Isaac. Isaac came up to me to get a treat, and apparently he got too close, and Whiskers just smacked him in the face. That's rude, Whiskers. Alright, so that's it for today. Everybody have a good day. Stay safe. Stay well.